Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. Joining me as we cut through the fog that exists at the leading edge of healthcare technology. My guest today is Julie Skaff, who is the Chief Operating Officer at Viz.ai. That's Viz.ai, Viz.ai, a leader in applied artificial intelligence in healthcare. Their mission is to fundamentally improve how healthcare is delivered through intelligent software that promises to reduce time to treatment and improve access to care. Julie, welcome to the Tate Chronicles.
Thank you, Jim. It's great to be here.
I was reading through some of the things, some of the blog posts and some other information on the Viz website. That's Viz.ai. And one of the things that really struck me was how your platform and your technology can often really drastically reduce time to treatment. So let's kind of start with this AI-powered care coordination. What is it and how does it work?
Yeah, it's great. Thank you. And again, thanks for having me on today. So Viz is an intelligent care coordination platform that really aims to close the gaps between patients, clinicians, and increasing access to life-saving treatments for patients. And so we do that practically by enabling multidisciplinary teams to view images quickly, communicate seamlessly, and coordinate care to dramatically improve patient outcomes. We actually started in neurology, seeing the significant need in stroke, then aneurysm, subdural hemorrhage, and other areas, because these are life-threatening conditions that are both acute and chronic. And as we've grown, we've recognized the need in other areas and have expanded now into vascular and cardiology. But really practically, how does it work on the ground is probably what you're wondering. And so our artificial intelligence essentially runs on images like CT scans and detects suspected diseases, then alerts those care teams of those suspected diseases, again, like stroke, aneurysm, hemorrhage, subdural, pulmonary embolism, other diseases. Those care teams are quickly alerted through the Viz app so that they can view the images, they can communicate through a HIPAA-compliant chat, and they basically mobilize to review and act. And today, Viz covers more than 22 million lives across more than 1,300 hospitals in the US and overseas. This includes actually now the majority of the top 50 integrated delivery networks. And there's 35,000 providers who are actively engaging in the platform. I think what's really critical, though, is actually something that's built into the DNA of the company. Comes from our co-founder and CEO, Chris Mancy. He's a neurosurgeon by training. And that is that Viz is really designed entirely with the provider workflow in mind. It's entirely designed around that workflow. So care teams, they can really get enormous outcomes improvements and improve the quality of life of the teams delivering the care at the same time. So they're able to support a case from anywhere, right, through the power of their phone, on the web, or at their radiology workstation. And this is really translated to 90% of our alerts being viewed within 5 minutes. So those care teams can act quickly and then generate those much improved patient outcomes.
We often hear the phrase, the golden hour, which is when there is time-sensitive insult to the body in some ways. That first hour is so critical. And so let's kind of talk through the workflow a little bit. So maybe somebody shows up at the emergency department, suspected PE or stroke or whatever, and an imaging study is ordered. And so that image, is it transmitted just electronically into your system?
Yeah, exactly. So we configure the scanners so that the image is transmitted to Viz, basically in the cloud. The algorithm runs, and then within a few minutes, the alert would go out if the algorithm detects a disease. And so that's when, practically speaking, it's like getting a loud text message on your phone or again at your workstation. And that's sort of the hook, that's the trigger. And that's where the AI is really allowing us to speed up and, to your point, get into that golden hour. And so, practically speaking, actually, you've got we've done a lot of studies, of course, and this is where I think Viz is a little bit unique, that there is significant real world evidence on the better patient outcomes from using Viz. In a case like stroke, you spoke about the golden hour. If there's a large vessel occlusion, the patient loses on average 1 million brain cells essentially per minute. So every minute counts. And so by speeding up that time to treatment, you're actually dramatically reducing disability, reducing mortality, and then also reducing length of stay, and saving a lot of time for clinicians. So a couple of the studies have shown our LVO product, which is for stroke, large vessel occlusion, has shown a 40% reduction in disability at 90 days. That could be the difference between somebody walking out of the hospital, right? It's also a 2.5 day reduction in length of stay at the hospital, 3.5 days reduction in the ICU. So those types of outcomes, to your point, that's that golden hour. That's if you can do things quickly and deliver the right care for the right patient, you got a big outcome.
And so let me kind of break it down to some specific questions I'm really interested in. And some of this may be proprietary. If it is, I understand. So how was your AI system trained to know what's normal and what may be abnormal?
Yeah, I won't go into a ton of detail, but we're essentially training on hundreds of thousands of scans. So we've got a large team of AI developers. One of the really important elements is that they're training on data. We get that from clinical research, lots of different repositories for that data. But one of the really important elements of it is, you've got to be very careful. And this is another element we might talk about in AI, where you need to make sure that you're not introducing bias into the training. And so having the diverse data sets, diverse populations represented in the training is going to generate, better outcomes and, more equitable, programs. And so that has been a big focus for us, doing as much as we can to reduce bias, eliminate bias.
And so as soon as the imaging takes place, is it really within a matter of seconds that the AI is examining?
Yeah. Practically speaking, exactly. So every scanner in the hospital would be directing to our cloud, and the algorithm is running on the cloud and then alerting to whatever the workstation is for the patient, where it be their phone, or again, in the hospital, like a radiologist sitting at their workstation. And so, but that typically is happening in a couple minutes. And normal workflow would be sequential in a lot of these cases, and could take, especially in the case of remote care, where you've got maybe a spoke hospital in a very rural area, and you don't have the neurologist or specialist on site there looking at it. It could take several hours for the care team to be alerted. In this case, you're eliminating that time and getting the alert within a couple minutes. So it's a call to action that is pretty profound.
And so is the best practice with your platform is that all radiographic images go through the AI screening, for lack of a better word, or just
and we ingest a number of modalities now, non-CONS-CTs, CTs, MR, etc. There's ECGs. It's a wide range, but yes, that is the case.
Well, and so in some cases we talk about stroke where there's an abnormality, and the time element is extremely critical. In other cases, there's something wrong, but it's not time critical.
Yeah,
How
exactly.
does that, how does that get differentiated out?
Well, I think, it's all about the workflow
Hmm.
again. And so in that area, it's really about understanding the workflow, the time sensitivity of the treatment, and also what's going to be best in terms of getting the attention of the physician. So in some cases, you might be looking more at a batching for review of cases, but generally speaking, yeah, it's all about the workflow and making sure that the right physician is looking at it in the right moment for that particular disease. One of the things also that is key here is that care coordination and the referral path, where it's not just that the patient is identified, but you're actually getting them. So in the case, say, of identification of there was a cryptogenic stroke, for example,
Hmm.
making sure the neurology team, there may be a PFO, there may be other things and a reason that you need to have a referral to cardiology. And this is another element where being able to communicate with those clinicians while the patient is still in the hospital, without having to lose track and loss of referrals is really key. And so that's another element where the platform plays a big role.
And so the image goes into the AI platform. Let's say an abnormality that's time sensitive is
Mhm.
identified, and notifications go out to the team that's going to be involved, along with the image, or at least a link back to the image.
Yes,
Correct?
exactly. No, they so the platform itself includes there's the algorithm, there's
Hmm.
the within the app, so they're able to actually see it there, and then there is the communication surrounding it, so they can do their work within the application to coordinate the care. But yeah, you're exactly right. The algorithm is run, the alerts are done, um, and again, they can do all of their work within Viz to coordinate the next steps.
Well, one of the things that seems important for AI systems is the ability to continue to train, and often that may be from feedback.
Mhm.
And so, for where in the process where there be an opportunity for providers to give feedback on an alert they received of an image.
Yeah.
Yeah.
So we are constantly getting feedback. We have a number of mechanisms for this. One would be, again, looking at feedback from physicians. We of course have a technical support team, so we want to understand, how the algorithm is performing. And of course, we've set, our standards for sensitivity, specificity, positive predictive value. And so that is to be clear. And then we're constantly getting feedback from clinicians. We're also running clinical trials, and also have our own annotation team
Hmm.
assessing it, so that you're constantly training the algorithm to increase that sensitivity, increase the specificity, so that you can reduce the number of false positives over time, and certainly a keen awareness of any false negatives, which is something that any algorithm developer is very sensitive to.
Let me just take a moment and say to our listeners, if you're just joining this episode, I'm Jim Tate, and on this episode of the Tate Chronicles, I'm speaking with Julie Skaff of Viz.ai. One of the things about AI that we're all kind of learning about, Julie, is as the evolution of AI takes place, not
Mhm.
only in healthcare but in other areas, there needs to be some type of guidelines. An example I'll give is in healthcare, there is, lack of a better word, a best practice now that anything that's generated by AI that has to do with treatment, before an action takes place, a human should be in that loop. And so, in the case of the work you're doing, obviously, humans, put their eye on that image before they do any type of therapeutic treatment, invasive
Right.
or medical or whatever. And what other types of guidelines, especially in healthcare, do you think are going to, that you're aware of, or we may see in the future?
Yeah, I think this is really a fascinating area. And there's two angles that I think are interesting if you think about it from a company like Viz.
Mm-hmm.
So one was a really momentous guideline that was introduced by the American Heart Association just earlier this year. And they said that all levels of stroke centers must have an artificial intelligence platform. And this to me, this was a really clear statement of the real world evidence that we're seeing for the impact and the improvement in patient outcomes that you can have from a platform like Viz. And so that's a big deal, right? These aren't things taken lightly. Unfortunately, there are a lot of stroke centers that aren't necessarily, they don't have those AI platforms yet, but that's something that I think is really interesting that the AHA came out with that kind of statement. And I do think, as this type of technology is adopted, you're going to see a lot of improvement in access to life-saving treatments, which of course is our mission. There's another angle to this, which is that guidelines are also getting more stringent for hospitals. And we know that that's tied to a lot of things, including reimbursement. But the American College of Surgeons actually just set the trauma center standards now are that level 1 and level 2 trauma centers must have the necessary human and physical resources continuously available. That means 24/7, 365 days a year, so that an endovascular or interventional radiology procedure for hemorrhage, for example, for hemorrhage control would begin within 60 minutes of the request. And so that's a lot, but what it means is that's, you understand the environment right now with labor shortages, staff burnout. And so leveraging something like Viz can be a game changer to try to, again, streamline the workflow. And so one of the hospitals that we've partnered with, they started using Viz and they actually got their time under 60 minutes. So they went from 62 minutes to 48 minutes from that end to end of, getting it basically into procedure from the request. A really big improvement. So they are now within the guidelines thanks to embedding Viz in their workflow. And so it's kind of interesting, right, Jim? I think there's the angle of we're going to start seeing AI responsibly, I think, embedded into guidelines, and there needs to be a lot of thought put into that. But then you're also going to be seeing platforms and technology leveraged so that hospitals can better meet those guidelines and hopefully exceed those guidelines over time.
And so those trauma centers you're talking about where the designated members of a specific team are actually on the campus someplace or are close enough to get there within a certain amount of time, I'm sure that has worked out. But I guess the current workflow is somebody gets an image, looks at it, and then multiple emails or text messages or phone calls go out.
In a lot of these settings, it's a text message, it's a phone call, it's an email to someone. It's not the instantaneous communication.
With the image. And so that's right there, just the one that you quoted, a savings of at least 15 minutes right there, all things else being equal.
Yeah.
Well, not only the time, but the fact that they've seen the image already before they show up bedside or in the OR. Let's talk a little bit about current challenges of AI and really the future of AI in healthcare. When I was at the HIMSS conference recently, of course, this November, the buzzword is Chat GPT, and almost every EHR I saw at the HIMSS conference has already embedded Chat GPT into their platforms. Not really doing the type of AI you're talking about, but maybe generating a patient-specific dietary plan or exercise plan based on their diagnosis, things like that. And so kind of in the background for most folks, AI and machine learning is just was kind of a intellectual concept, but now it's being thought about so much. And like Viz.ai, how old is Viz.ai? How long have y'all been a company?
Yeah, we've been around since we're actually coming up on 7 years. So it was
Wow.
June
Yes.
2016.
Yeah.
Yeah.
And when did you go live? When were your
Yeah,
first?
we had
Yeah.
our first clearances in 2018 in stroke, and now we've got 11 cleared software as a medical devices.
And your customers you work with primarily health institutions, hospital
Yeah.
systems. Yeah.
Yes, primarily hospital systems, and we're also now supporting. We've got other avenues like supporting clinical trials with our platform called Viz Recruit, which is a really interesting one and ties back a little bit to what we were talking about. How do you collect real world evidence? How do you get feedback? How do you make sure that you're getting diverse data sets?
Yes.
Where we're actually leveraging exactly the same platform we discussed to identify candidates for trials, for the clinicians to have a discourse about it no matter where the patient is physically. So this really gets at the discrepancy between rural access to care and that asymmetry that we have in the US. But it's an ability for them to enroll patients in trials much faster and get those life-saving treatments to the market faster. It's a bit of a tangent, but I think it's an important element of you were asking just about who are we serving and
Mm-hmm. And is it primarily hospital systems in the U.S. or are you?
yes, we're
Yeah.
predominantly in the U.S. but also in Europe, Middle East, and Africa.
And so AI and its role in equity, healthcare, and avoiding actually whether it's implied bias or algorithmic bias in clinical trials. That's kind of what you've been talking about. Many medication clinical trials historically were based on, I don't know, Western European DNA primarily. Uh, and so, how were you able to really address that? Is that you want to make sure, I guess, that your scans, your AI is training on from a wide network of
Yeah.
humanity.
Yeah, it's a really important point. I think, if you're thinking generally the challenges in AI, and AI in healthcare, I think the challenges in AI kind of reflect the same things that we're seeing in society overall. And it has to do with if you have bad data in, or if you have a misrepresentation of the data
Mm-hmm.
going in, then the outputs of the models are going to reflect that. And so I think, the same approach that we're taking to research, making sure that we have diverse data sets by gender, by age, by race, by backgrounds, having the full diversity of those data sets. That's just a cornerstone. It's a prerequisite to
Yeah,
training these models.
yeah, that in healthcare, but in a lot of other fields, that is a whole area of research by itself to
Yes, absolutely.
bias, the data sets essentially. Yeah,
Yeah.
that's gigantic. And so, training your models. I'm thinking about facial recognition AI software, where a lot of that was actually just trained off images of faces on the internet. They could run software against that kind of stuff. Did you just get a lot of normals and abnormals and run them
Yeah.
through your
Well,
system? Yeah.
yes, and this is a moment where I'm wishing that I had some of the leaders from our AI team on. But yes, that's absolutely correct. It's getting that huge data. I mean, huge data. So we were talking about hundreds of thousands
Yes.
of scans, and again, making sure that you have the representation from all of the different demographics we were talking about. That's how the models are built. I think it's interesting when you mentioned GPT-4
Mm-hmm.
and large language models. That is a huge opportunity for healthcare. The ability to take unstructured data and natural language and establish the insights that could be applied. I think in healthcare in particular, this has been a huge barrier to efficiencies, increases in productivity, increasing access, bringing down the cost, all of these things. there are real opportunities, if done responsibly, if done well, that we could really make major improvements in the healthcare ecosystem. And so this is probably the area where I'm most excited about the next era.
I couldn't agree more. And the use case that Viz is involved with is an area that is so primed for success.
Mm-hmm.
I mean, just the way that, the AI systems don't get tired. They don't have a headache after they've looked at 50 images, all those kind of things that we've always kind of worried about. We're almost out of time, Julie, but before we sign off, where can people go to find more about Viz and what you're doing?
Well, our website is Viz.ai, Viz.ai. And that would be the place to go. We've got areas that you can connect with our team. It's an exciting time, and also a lot going on in healthcare and AI. And so I'm hopeful for the future of how we're going to deploy things, and especially for Viz, as we're moving into vascular and cardiology and these new care areas, expanding our footprint in the U.S., delivering more value to the patients that we serve. It's a great thing, and I appreciate you having me on.
Well, I'm glad to have you, Julie. And it's great to see a use case that it has already delivered on its promise. It's in the field and it's working, and it really shows the advantage of AI. To our audience, thanks for joining me on this episode of Tate Chronicles. I offer a special salute to my guest today, Julie Skaff of Viz.ai. That's Viz.ai. You go to that website. Julie, thanks for coming aboard today.
Thanks for having me. Appreciate it.
You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.